Good afternoon. Yesterday, we recorded almost 20,000 new cases. You recall that at the last press conference, we did say that we anticipated a major Omicron wave. We are now in the middle of this Omicron wave and are still climbing the epidemic curve. So far, most of the cases continue to be mild, especially for those who are fully vaccinated. Overall, our healthcare system remains stable and has been able to cope with infections. We are likely to continue to see daily case numbers of between 15,000 to 20,000 or even higher. Based on experience of other countries, we expect cases to peak in a few weeks' time before they start to come down. And when this happens, we can then further ease our measures and resume our journey towards living with COVID-19. In the meantime, we will streamline and rationalize our border measures, healthcare protocols, and safe management measures, or SMMs, to prepare ourselves for reopening after the Omicron wave subsides. We will simplify our SMMs so that they are easier for businesses and people, individuals to understand and comply with. This will also encourage a greater sense of personal responsibility, which will play an increasingly important part in our journey towards COVID resilience. We will use 5 key parameters to define SMMs, and these are group sizes, mask wearing, workplace requirements, safe distancing, and capacity limits. The posture we adopt for each of these parameters will depend on our risk assessment. Minister Lawrence Wong will elaborate further later. For now, we will keep to our current SMMs, but with some tweaks. Once the wave is over, we can then consider bolder moves, such as adjusting the group size to 8, 10, or even more. We will continue on workplace management. We will continue to require 50% of employees who can work from home to work from home. But we will align workplace SMMs with community SMMs to simplify the rules. This means that workers who have their masks on will not need to maintain safe distancing in the workplace, and social gatherings of up to 5 persons will be allowed in workplaces. Earlier, we had enhanced our border measures and temporarily reduced the vaccinated travel lane quota to give us time to know more about Omicron variant and to adjust our SMMs. We will now update our border measures, and Minister Iswaran will elaborate on this later. For VTL land, vaccinated travel lane land, we will reinstate the original quota for entry into Singapore to 2,160 travellers a day. This is equivalent to 48 bus trips. This will take effect from 22nd February. Sales for the additional bus tickets will commence with immediate effect. VTL land travellers will be subject to the same testing requirements as all other VTL travellers. We will progressively expand VTL land, taking into account the public health situation in both Singapore and Malaysia. Singapore remains committed to living with COVID-19. The key SMM parameters that we have announced today will help us prepare for the transition to a COVID-resilient nation and give us the flexibility to respond quickly to the evolving health situation. As we brace ourselves for the peak of this infection wave, I would like to remind everyone to keep to the SMMs, test yourselves regularly, especially before visiting crowded places or interacting with vulnerable individuals, and follow the healthcare protocols if you do test positive. Those who are eligible to receive your booster shots should come forward to do so as soon as possible, as this will better protect you against severe illnesses. Let us continue to work together and progress in our opening journey. Thank you. I'll now pass it on to Minister Ong Ye Kung.
Thank you. As Minister Gan mentioned, yesterday cases shot up to 20,000 almost. Today the indications are that it will be slightly lower, and some members of public are understandably anxious because of the high top-line number. But please be assured, the MTF will always look at our pandemic situation closely and objectively. Any deterioration in the situation, we will not take it lightly, but neither should we panic unnecessarily. Our assessment of the situation, or MOH assessment of the situation, is this. First, the 20,000 daily cases is actually within our expectation. In fact, it is very in line with the projection of our scientists that has a model for the Omicron wave. And we have also said before that the Omicron variant being more infectious, we should expect cases to reach 15 to 20,000 a day, and maybe even more. Second key point is that our worst fear, which is the ICU wards being overwhelmed, thankfully did not happen, and no sign of that happening. As I've said before, we need to look at how the healthcare system is coping. Number of patients in ICU, number needing oxygen supplementation, number needing hospital beds, and not just the headline infection number. And today, ICU occupancy is hovering around 20 to 30 cases, goes up and down. During the Delta wave, it just goes up. During Omicron wave, actually day to day, you see it going up and down. And between 20 to 30 beds, and this is a fraction of the beds occupied during the Delta wave. And this is because Omicron is inherently a less severe disease, but also very importantly, our vaccination, our boosters are working. Third key point on our assessment is that notwithstanding the above, there is stress felt in the healthcare system, especially at the front end, namely the GP clinics, polyclinics, also our hospital emergency departments. Many patients are going there. But the GPs, also the EDs, have been telling us that actually a great majority of patients that go to them have no symptoms or mild symptoms. It is important for us to preserve primary care capacity as well, just as we want to preserve hospital capacity, so that care goes to those who need it the most. Hence, yesterday we announced that MOH now allows individuals who suspect they are infected, they can now go to our combined test centers or quick test centers to get themselves tested, supervised, and if they are tested positive, they will get an official infection record in their health hub. And their test results can also be used to show their employers so that they can be excused from work. And employers, please accept those documentation. But please consider using this avenue, using the CTC or the quick test centers, or simply recover at home if your symptoms is mild or you have, in fact, no symptoms. Given that we are still climbing the epidemic curve, today is not the time to announce any easing of restrictions. It is, however, an important juncture to review in depth our current rules, and we have done so. This is because if Singapore is like many other countries that have gone through or are going through the Omicron wave, in a few weeks, cases will come down, perhaps even quite dramatically. And then we will be in a position to ease travel rules as well as our domestic safe management measures, or SMMs. We have therefore reviewed our rules to further adapt to the characteristic of Omicron variant. And at the same time, with this in-depth review of our rules, we will streamline and rationalize them. And these rules have accumulated over the past 2 years and have become quite unwieldy, actually. And by streamlining them, we can adopt a posture that will better enable us to open up when the timing is right. I will therefore cover briefly 3 areas: health protocols, travel policy, and SMMs. And DMS, Minister Iswaran and Minister Lawrence Wong will further elaborate on the changes that we are making. So first, health protocols. We must remember almost everything about Omicron variant is faster than all previous variants. So for example, Omicron patients recover faster, which is why we shortened the discharge period earlier. Omicron also has a shorter incubation duration and an earlier infectious window. You put that together, the result is that it has a very short serial interval. What is a serial interval? This refers to the time taken between a first person infected and experiencing symptoms and the next person that the first person infected to be also getting symptoms. That is called a serial interval. Based on our studies, the serial interval for Delta is about 2 days. The serial interval for Delta is about 4 days. The serial interval for Omicron is as short as 2 days. So our health protocols need to adapt to this distinct characteristic of Omicron, of having very short serial interval. DMS will explain some of these changes. I will touch on one, which is the requirement for RRT or rostered routine tests. Testing remains an essential part of managing the pandemic, because if an individual can use an ART to detect infection early, he can take precautions to avoid transmitting to other people, especially vulnerable persons, such as seniors, the sick, or unvaccinated children. However, because of the characteristic of Omicron, we need to rethink the way we deploy ART. Today, workers in many sectors, such as those working at the airport, seaport, the malls, restaurants, hawker centers, etc., they are required to perform weekly ART, which is what we call RRT, rostered routine tests. The positive rate for RRT is not high, on average less than 0.2%. Yeah. And that low percentage is not surprising because for Omicron, even if someone is infected, there's only a very short period where he's infectious and which ART can pick up the infection and become positive. So RRT is also no longer very effective to prevent the spread of the virus. Because of the short serial interval for Omicron, by the time you go through RRT and pick up a case, the individual most likely would have already spread to other people. Hence, it is better that we switch to a regime where people are advised to be very vigilant and very considerate. If unwell, immediately take an ART test. Make sure you are tested negative before you go out, and especially if you are meeting someone vulnerable. We will therefore stand down the requirement for weekly RRT for most workers, but we will retain RRT as a precaution for some sectors, namely healthcare, elder care, and preschool, because these are the three sectors where workers continue to meet vulnerable persons, namely seniors as well as unvaccinated children. Second area I will touch on is travel policy. Here, we need to pivot our principal consideration. In the past, the objective of travel rules was to prevent the import of infections into Singapore. That is why around the world it is common practice to test a traveler before he departs, after he arrives, and then it can also follow by a period of quarantine that we call SHN, or stay home notice. Now, imported infections are about 1% of total daily case counts. So they no longer have a material impact on our epidemic situation. Now the concern is that should a traveler come into Singapore and be infected, is he protected well enough such that he does not become severely ill and burden our healthcare system? Hence, we should actually emphasize less on SHN and tests on travelers, more on ensuring that they are fully vaccinated and boosted. This will require quite a fundamental change to our travel schemes. Instead of having vaccinated travel lanes or VTLs with selected countries that we think are low risk, we should actually allow SHN-free traveler for vaccinated travelers, fully vaccinated travelers from all countries. And we should make this transition, not now, but after Omicron wave has peaked and start to subside. And rather than an abrupt change, we should also make this transition in steps. We will take the first step now to put ourselves in a better position to make that subsequent pivot. What changes are we making? Let me briefly explain. Today, we classify countries and regions into 4 categories and labeled them 1 to 4 in ascending order of risk. These categories will no longer be relevant when we move to a vaccinated traveler system. Yeah. We want the traveler to be vaccinated and protected rather than the country infection rate to be low. The consideration will pivot. We therefore, in line with this consideration, we will make the following changes. We will create a new general travel category where we will place all countries and regions currently in category 2, 3, 4 into this general travel category. And then within that, we apply a standard home SHN period of 7 days for this category, for travelers in this category who are required to serve SHN. As you may know, today, travelers are subject to varying durations of SHN depending on which country they are traveling from. And then separately create a restricted category. There will be no countries in it at this time, but we need this category to cater for instances such as when there is an outbreak of a new variant of concern, and we need to impose border measures on travelers from those affected countries and regions while we assess the situation. And that's the purpose of the new restricted category. And finally, we'll simplify test requirements as we move from preventing imported infections to ensuring that a traveler is fully vaccinated and well protected against severe illnesses. We should step up checks on vaccination status and step down checks or step down test requirements for the travelers. We have earlier changed the pre-departure test of travelers coming to Singapore to accept ART in addition to PCR tests. We will now change on-arrival tests to ART as well. We will also move on-arrival ART tests for travelers out of the airport to one of the 200 quick test centers or combined test centers around the island, and some of them are in fact in malls or hotels. Travelers will receive a booking link to take their ART within 24 hours of arrival. Minister Iswaran will speak more about this, as well as changes to the current VTL schemes. Final topic I'll talk about is SMMs, safe management measures. You will remember in October last year, we reset our health protocols. At that time, the rules were quite complicated, and we reset all of them into only 3 rules that we now know, that is now known as Protocol 123. Similarly, we also have many SMM rules now, including unique rules for specific settings. Like health protocols, we have done a reset to simplify and streamline SMMs to 5 parameters that we will call SMMs 1 to 5. So we got Protocol 1, 2, 3 and SMMs 1 to 5. And through simplification, we think that people are more likely to understand not just the letter, but also the spirit of the rules. They will then be able to exercise individual responsibility and do their part to help manage the pandemic. Further, it will bring us to a position where we are more nimble and ready, that we can ease those SMMs more readily when the Omicron wave subsides, and we can tighten should the situation worsen, such as when there's emergence of another variant of concern. SMMs 1 to 5 cover 5 areas Min Gan mentioned, I won't repeat. But under each parameter, we can adopt a few postures from tight to relax, and given a pandemic situation, MTF will decide which combination of postures to adopt across SMMs 1 to 5. So Minister Lawrence Wong will elaborate how they will work and what posture we are taking. These 5 parameters crystallized what we learned to be the most important aspect of SMMs for pandemic control. And SMMs 1 to 5 will work hand in hand with protocol 1, 2, 3. And although SMMs 1 to 5 does not represent a relaxation, but a streamlining and a review of the rules, there is actually quite profound implications in the way we manage the pandemic from henceforth. And let me just cite three implications. Number one, with the reset parameters, should we encounter another new variant of concern and have to tighten up, we can work within these parameters. We'll try our best to work just within these 5 parameters and adjust the postures, instead of coming out with micro rules for different settings. And that will add up to be a confusing web of regulations. Number 2, so it's a lot more nimble. Likewise, when we need to ease up, we can also just relax the 5 parameters. Number 2, the new rules, with the new rules boiled down to 5, we no longer forbid practices that actually do not make a material difference to the pandemic, but which we are observing very strictly. For example, so long as people are wearing masks, there's no need to cross out alternate seats in park benches, for example, or the urinals in a men's toilet. And the men will know sometimes they are actually crossed out, alternate ones are crossed out, which is not necessary so long as you're wearing a mask. Or when people wear their masks and they stand together and take a photo, they don't have to be a meter apart. Yeah. You can place newspaper or magazines in common areas, hair dryers in public showers, so long as you maintain good hygiene. So I think all these little things really don't matter anymore, and we can do away with them. Our people know that we are in a crisis, and we can start to remove these little daily reminders that is not really material anymore. Number 3, the third implication is it involves a shift in mindset from the current paradigm where there is a prescribed list of things that you can organize and participate in to being able to proceed so long as we abide the 5 parameters that can effectively manage the risk. Sometimes we describe this as moving from a positive list to a negative list system. So there's some element of that here. It means barbecue pits can be open so long as people gather together and socialize according to the group size prescribed. You don't have to divide guests in zones for weddings so long as they keep to their group sizes and do not mingle across tables. There is no need for school assemblies to be restricted to 30 minutes, which is the rule today. And we can also play sports again. The main driver of COVID-19 transmission is prolonged and close contact, like eating together in an enclosed place. Sports, on the other hand, while we are playing, involve transient contact between players on the field or on the court. Hence, there has been no compelling international evidence showing that sports participation causes more infections. You are more likely to catch the virus dining with friends than playing sports with them. But what is more important is to ensure the players observe group size and masking rules before and after the game and during the breaks, because that is when they will have prolonged and close contacts. 2 years of SMM restrictions have taken a toll on the physical and mental well-being of our people, particularly so for the young, who are in their growing years and should keep active through sports. Under SMMs 1 to 5, this will be allowed, and we can allow more sporting activities. Some details in the press release. I hope everyone internalize SMMs 1 to 5, understand their purpose and spirit, and conduct our activities accordingly. I now hand the floor to DMS. Thank you.
Thank you very much, Minister. I will elaborate on the revised health protocols that we are introducing based on our greater understanding of the Omicron variant and how Omicron infections are presenting. I will start off first by talking about measures in our nursing homes. Some of these are a response to the community surge in cases that we are seeing at this point in time. We had previously suspended in-person visits to all hospital wards and residential care homes for a period of 4 weeks through to the 20th of February 2022. And with the further rise in community cases this week, the need to further protect our healthcare capacity as well as vulnerable patients and residents remains. We will therefore extend the suspension of in-person visits for a further 4 weeks from the 21st of February through to the 20th of March 2022. The hospitals and residential care homes will continue to exercise discretion to allow visits for exceptional cases. And this may be, for example, when a relative is critically ill in the hospital or in the home. These visitors will be subject to the visitor management measures that the home or hospital may impose. The hospital or home will also support alternative methods for communication, such as through telephone or video calls, so that patients and residents can remain connected with their loved ones. In a study conducted by the Agency for Integrated Care, or AIC, with nursing homes, we noted that the majority of seniors who had Omicron infection in the nursing homes were mildly symptomatic and did not require the level of medical care provided at the hospitals or dedicated COVID-19 treatment facilities. And this is a big contrast to the situation we saw with the Delta wave. These seniors have benefited from the primary and booster vaccinations received at the nursing homes, which has protected them from severe infections and a bad outcome. We also understand how distressing it can be for our nursing home seniors to move away from familiar environments in the homes to the hospital or the CTFs. Hence, from today, MOH will progressively support nursing homes to cater for their fully vaccinated but COVID-19 infected residents to allow them to recover in situ within their premises, provided they are asymptomatic or mildly symptomatic. These residents will be isolated away from other uninfected residents. The homes will be monitoring them closely and will provide them with appropriate care. Our acute hospitals will also be supporting these homes so that the requisite clinical expertise will always be available to ensure that these generally well residents who are now infected may recover safely in these homes. And those who are assessed to be at higher risk or who show early signs of clinical deterioration, they will be conveyed to an appropriate care facility for further management. I move on now to other aspects of how we are simplifying our health protocols. We reviewed the outcomes of our patients infected with Omicron infection. The vast majority had mild symptoms or were asymptomatic and were able to safely recover on their own. For example, less than 3% of fully vaccinated patients below the age of 80 and non-fully vaccinated patients below the age of 70 years needed oxygen supplementation or ICU care in our hospitals. This is in contrast to those who were not fully vaccinated and above the age of 80, where more than 20% needed oxygen supplementation or ICU care. This data, showing more people having less severe infections, allows us now to simplify our health protocols and reduce the need for admission into the hospital or the community treatment facilities for treatment and care. This means more age groups of patients may now be managed by primary care physicians under Protocol 2 if they exhibit mild symptoms. From today, the 16th of February, all patients aged between 3 years and 69 years with mild to no symptoms, irrespective of their vaccination status, may be managed by their primary care doctor under Protocol 2 without needing a default hospitalization. Well and fully vaccinated but infected persons between 70 and 79 years will also be cared for by their primary care doctors under Protocol 2. All fully vaccinated but infected seniors aged 80 years and above, as well as non-fully vaccinated seniors between 70 and 79 years, may now be managed under our home recovery program, which is supported by telemedicine providers who can monitor and provide treatment as needed. And only infected persons aged 80 and above who are not fully vaccinated need then to be managed in a care facility, whether a hospital or CTF. These further details have been provided in our press release today. At any time, persons who feel unwell or have signs of clinical deterioration at home may seek consultation with our telemedicine providers or their attending GP. And if needed, they will be conveyed by ambulance to the hospital for further treatment. We have also reviewed the Protocol 3 for those who are close contacts of persons infected with Omicron infection. And we will be introducing a revision in the monitoring duration. The National Center for Infectious Diseases, or NCID, has studied the data in this group of close contacts and explained by Minister Ong the incubation period for the Omicron infection and the serial interval for developing the next wave of infections in both household and community settings is significantly shorter compared to Delta infections. And because most close contacts are developing their COVID-19 infections faster after exposure to someone who is infected, we have made the decision to make key changes to Protocol 3, and these changes will take effect from the 18th of February. Firstly, the recommended self-monitoring period will be reduced from 7 days to 5 days. This allows close contacts to come out of their self-isolation and resume their activities in the community faster. And this is provided they remain well and the self-administered ART tests performed during their monitoring period remain negative. We had previously issued close contacts of these infected persons with a health risk warning, or HRW. These warnings lasted 7 days from the date of their issuance, with a need for negative ART-based daily self-testing if they wish to leave their homes. But given now the shortening of the self-monitoring period, the HRW is less relevant and will be replaced by a new Health Risk Notice, or HRN, which will now identify and alert close contacts identified by MOH of their risk for getting an infection, and persons issued with the HRN can continue to obtain free ART test kits through the designated vending machines in the community to facilitate their self-testing during this shortened self-monitoring period. The HRN will be applied prospectively for close contacts. And if you were a close contact and you had previously received the HRW, you should continue to complete your existing monitoring period as defined within your HRW. These measures allow us to respond more nimbly to the Omicron wave of community infections which we are in the midst of. We anticipate that this wave will continue over the next few weeks. But these changes will allow us to continue providing appropriate care for those infected with COVID-19 while ensuring that our hospital resources remain reserved for those who have more severe infections. They will enable our public healthcare system to be more resilient and to be able to cope with the increased demands on our healthcare manpower who continue to work hard in our healthcare facilities to care for their patients with COVID-19 and non-COVID-19 related medical needs. Although our hospitals and polyclinics are still coping with the increased number of patients presently, we seek the public's cooperation to ensure that our primary care clinics and A&E departments can focus on and prioritize care for those with more urgent conditions. So, as a summary, if you're well and suspect you have COVID-19, please self-isolate at home. Test yourself with an ART test kit. And if you test positive, you may continue to self-isolate at home and follow the instructions under Protocol 2. If you have a need to confirm your self-test, you may book an appointment at any of our combined test centers or CTCs or quick test centers or QTCs to perform that supervised self-administered ART. There's no need to see a GP or go to a polyclinic or attend at a hospital A&E department for more testing or to seek a MC. You also do not need a recovery memo after you've recovered from your infection in order to return to work or to return to school. If you do have minor respiratory symptoms or have risk factors which may suggest a worse outcome when you get infected with COVID-19, you may continue to see your GP in the PHPC clinics or in the polyclinics. And they will assess you and determine whether you can continue to recover at home under our Protocol 2, Primary Care Enabled Protocol 2, or the Enhanced Home Recovery Program. If needed, they will refer you to the hospital or to the CTF for further care. You do not need to go to the hospital A&E at the first onset unless you're guided to do so. And for the rest of us, please keep your vaccination status up to date to ensure you receive the best possible protection against COVID-19. This means if you're now eligible for booster vaccinations, please get your booster dose without delay. And I continue to urge and encourage parents to bring their children for their vaccinations as soon as they're eligible, as soon as possible. And only by protecting each of us through vaccination can we derive the best possible protection for all of us in the community. Thank you.
Swara, after you.
Ladies and gentlemen, good afternoon. We started the vaccinated travel lanes in September last year as a pathfinder to establish, test and build confidence in reopening safely to vaccinated travelers. We made steady progress but had to take a pause due to Omicron. In late November, when Omicron was first reported, we tightened our border measures to limit our exposure, gain a better understanding of the new variant, and get more people boosted. These measures included deferring the launch of some VTLs and limiting the daily number of VTL travelers. Now that we have greater certainty over the nature of Omicron and the associated public health risks, it is important that we pivot our travel posture, as Minister Ong has outlined, resume the safe reopening of our borders, and reclaim our position as a global business and aviation hub. Let me now outline our next steps. I start with the air VTLs. We announced on the 26th of November last year that we would increase the daily VTL travelers' capacity to 15,000. Due to Omicron-related curtailments, the daily number of VTL travelers currently stands at 5,000. We are now ready to take steps to restore the flow of travelers. With immediate effect, we will lift the 50% cap on the daily number of VTL travelers. In other words, we will be able to restore the VTL quotas to the original levels that were announced before the Omicron-related curtailments set in. We will also continue to expand quarantine-free travel for vaccinated travelers from other parts of the world. Let me start with the Middle East. We will proceed with the launch of the VTLs to Qatar, Saudi Arabia, and the United Arab Emirates, which was a VTL that we had deferred earlier as part of the Omicron-related curtailments. We will also extend this to Israel to further rebuild our connections with the region. Within ASEAN, we will deepen and extend VTLs with Malaysia, Indonesia, Thailand, and the Philippines. We had commenced the VTL by air with Malaysia from the 29th of November last year, starting with Kuala Lumpur. We are in advanced discussions to expand VTLs to Penang and Kota Kinabalu, and we look forward to launching these soon. We had also launched a unilateral VTL by air with Indonesia from the 29th of November last year, with 2 daily designated services from Jakarta. We are in discussions to do more with Indonesia, and meanwhile, we will also be launching a VTL-C with Bintan and Batam, which I will elaborate on later. For Thailand, we had started the VTL with flights from Bangkok from the 14th of December last year. We will now expand the VTL to include all cities in Thailand. The Philippines has recently reopened its borders to vaccinated travelers from Singapore. We are establishing a new VTL to the Philippines as well. For both Thailand and the Philippines, with the VTLs, we will restore 2-way quarantine-free travel for vaccinated travelers. These planned moves with Malaysia, Indonesia, Thailand, and the Philippines will strengthen our air connectivity with our immediate neighbors, which is key to Changi's position as an aviation hub. For Europe, we have 11 VTLs today. We are studying how we can enhance this network and will announce more details in due course. We will seize the current unilateral opening with Hong Kong, as the Ministry of Health has reviewed the public health situation and reclassified Hong Kong in Category 2-3. With this classification by the Ministry of Health, our intention is, and we will, establish a unilateral vaccinated travel lane with Hong Kong. And our aim here is to maintain our air connectivity between our two cities. CAAS will provide further details on all these moves. I'll now update on our plans to restart cross-border travel by sea with Indonesia. Indonesia has resumed tourism travel from Singapore to Bintan and Batam. Specifically, fully vaccinated travelers from Singapore can travel under Indonesia's travel bubbles to the Nongsa Sensation and Lagoy Bintan resort areas without quarantine. To facilitate bi-directional quarantine-free travel, we will launch our first VTL-C with Bintan and Batam. Similar to VTL Air, vaccinated travelers from both islands will be able to enter Singapore and will not be subject to a stay-home notice. Short-term visitors from Indonesia need to apply for a vaccinated travel pass and meet all the prerequisites. Designated ferries will provide services between the Bandar Bintan Telani Ferry Terminal in Bintan or the Nongsapura International Ferry Terminal in Batam with Singapore's Tanah Merah Ferry Terminal. We will commence with a weekly quota of 700 travelers, 350 each from Bintan and Batam. We will start the VTP applications for VTLC on the 22nd of February and commence the VTLC from Bintan and Batam from the 25th of February. MPA will provide further details. Let me reiterate the context of all these moves and set them in context. As we learn to live with COVID-19 and Omicron, it is essential that we progressively open our air and sea borders. These steps will restore and expand our VTLs and put our border reopening back on track. They will enable us to carefully restore our connectivity, especially our regional neighbors. The connectivity with them is specifically important for our hub, and we want to do all of this while safeguarding public health. Our ultimate goal is quarantine-free travel for all vaccinated travelers. And as we welcome more travelers, our airport and ferry terminals are working hard to ramp up their capacity to serve travelers safely and efficiently. One key factor is the testing requirement at the airport. MOH has just announced a shifting of on-arrival testing to supervised self-swab antigen rapid tests. This will ease operational flows at both the airport and ferry terminal and allow us to scale up to accommodate more travelers. Our aviation sector companies are also progressively recalling their workers as well as hiring new manpower to be well prepared, and this may take some time. I seek the understanding and support of all Singaporeans and travelers as our aviation community and frontline workers scale up and make the necessary operational adjustments to ensure a smooth travel experience.
Good afternoon. Let me elaborate on what we are doing to reset our safe management measures, or SMMs. As you have heard just now, over the last 2 years, we have expanded our SMMs, and these moves were necessary when we wanted to actively control and suppress the spread of the infection. Now we are in a new phase of dealing with the pandemic, and at the same time the rules have become complex, unwieldy, and it's becoming harder for people to remember or to follow the rules. And that's why we have worked very hard to distill the SMMs to the 5 key parameters that were highlighted just now: group size, mask, work from home, safe distancing, and capacity limits. These 5 parameters. Why are we doing this? As was explained, first, we think it will be easier for everyone to remember and understand the rationale for these MMMs, and so comply with them and adjust to a new phase of having to live with the virus. Second, having these key parameters will enable us to adjust the SMMs more nimbly and responsively. So if we were to ease in the coming weeks, we can ease along these 5 parameters. And if ever there is a need to tighten because of the threat of a new deadly variant, we will also be able to tighten along these 5 parameters. So let me now explain the settings across these 5 parameters and how we are streamlining and rationalizing our measures. First, on group size for social gatherings. They will stay at 5 persons for now. But today, we have an additional restriction that households can only have up to 5 unique visitors visiting per day. That's an additional restriction. We will do away with that restriction so that households can have up to 5 persons visiting at any one time. So group size of 5 for social gatherings, and households can have up to 5 persons visiting at any one time. Mask, we will remain status quo for now, so mask on as a default both indoors and outdoors. Work from home today, the rule is that 50% of the people who can work from home are allowed to do so, so we will maintain that at 50% for now, but we will align the workplace SMMs with that of the community. So there is no need for more stringent workplace requirements, which are the case today, because we were worried about workplace transmission. So at workplaces, we have put in additional restrictions about what you can do for lunch breaks, social gatherings, and all that. We will do away with that. So the key workplace parameter is the work from home parameter, which remains at 50% for now. Safe distancing, there will no longer be a requirement for safe distancing if masks are on. We encourage you to do so, but it's no longer a requirement. So as Minister Ong shared just now, if everyone is mask on seated, you do not need to have 1 meter apart, you do not need to mark out seats and all that. And I think that will free up a lot of restrictions in schools, in parks, in many places. If masks are off, then 1 meter safe distancing rule will apply, and it will apply consistently across all settings. Because today, we also have different kinds of safe distancing rule. In some kinds of activities, we say it's more risky, so 2 meters. So we will do away with all that and simplify it. As long as masks are off, 1 meter safe distancing across all settings. Fourth, capacity limits. Today, we have different event size limits for different kinds of events, whether it's religious services, business events, media conferences, wedding receptions. Then you have different group sizes and all that. So we will do away with all of that. Because generally, if you are having an event with mask off, then the 1 meter and the group size rule will apply anyway. So instead of all these different event size limits, we will just have a simple capacity limit rule. And the rule will be, for now, 50% capacity limit, and it will apply to larger events or settings where there are more than 1,000 people. For example, you have cruise ships, you have malls, you have stadiums, you have theaters and conference halls. So that 50% capacity limit will apply to settings like these. And we will no longer need zoning requirements or separate caps on the sizes of different events. Right? So if you have a theater that can sit typically 3,000 people, then in today's rules, 50% capacity limit means you have 1,500 people who can be seated in the theater, and if everyone is masked on, then you do not need to have 1 meter apart. So these are the 5 key parameters that we have tried to distill in order to reset our SMMs. These are what we think are the most important and effective parameters based on the experiences of the last 2 years. We have tried very hard to do it to 3 parameters, like healthcare protocol 1, 2, 3. Initially, we thought we might do it simplified to 3, but that proved to be too difficult. I think it's not bad, and it's quite an achievement that we can simplify and distill to these 5 parameters, and then streamline and rationalize just along these 5 parameters. And we will put in place the rationalization and the reset from the 25th of February onwards. There are some specific dates for different settings, and the details will be in the statement and in the annexes to the statement. Besides these 5 key parameters, we do have a few other specific rules which were designed to address higher risk activities, specifically rules around singing, alcohol consumption at F&B outlets, and nightlife activities. For now, we will not make changes to these rules, but over time, as we adjust our overall posture around the 5 key parameters, we will also be reviewing and updating these specific rules for the settings which I have just described. The reset of the safe management measures, as I highlighted just now, will help set the stage for further easing down the road. This is not the time for easing. What I've just described is streamlining and rationalization. It's not the time for easing because we are still seeing an increase or a rise in our infection. And in fact, we are seeing very high infection numbers now. But we are quietly confident in facing this Omicron wave because our people, everyone in Singapore is well protected with vaccinations and boosters. And as you heard from Minister Ong and DMS, the vast majority of people who get infected are not so ill. So the numbers needing oxygen or ICU care remain manageable, and things are generally well under control. And that's why we have not seen a need to tighten our measures up to now, and we still do not see a need to tighten measures. And in fact, if the overall situation continues like this, meaning to say, we continue to see that oxygen ICU care remains manageable, things are well under control, we will be able to take further significant steps to ease after we have passed the peak of this wave, which can happen in the coming weeks. And at that time, we will be able to make a decisive move to ease across these 5 key parameters, which means group size, we can potentially go up to 8 or 10, as Minister Gan mentioned just now. Capacity limits could go up from 50% to 75%. Work from home requirements, you may have more people being allowed to go back to the office from 50% to 75%, and so on. So I hope everyone understands the rationale for the reset of the SMMs. There are just 5 key parameters to remember, so please continue to cooperate with them, SMMs 1 to 5, and follow them on a daily basis. And if we all continue to do our part, we can make good progress in our journey to live with COVID and become a more COVID-resilient nation. Thank you.
Thank you. Questions from the media?
Dear members of the media, please remember to use the raise hand function on Zoom if you'd like to ask a question. A gentle reminder to speak slowly and into your mic when asking a question and to keep to one question. May we have the first question from Timothy from ST?
Thank you, Ministers and DMS. Now, quite a few measures were eased today because of the mild nature of Omicron and also our high vaccination and booster rates. But I think some of the Singaporeans, especially those who got the boosters early, are wondering if the protection given by vaccines and boosters will weaken over time and what happens after that. Could you please comment on that? If it might mean measures will be tightened again then, or we'll need to keep getting boosters to avoid this. Thank you.
Thank you very much for the question, Timothy. We are continuing to monitor the situation as well as the evidence for the protection from vaccines, both primary as well as boosting, as well as what vaccine breakthrough infection rates are. We know that there are some countries who have embarked on the journey towards providing a second booster, what they call the fourth dose. But at this point in time, we have looked at the evidence. We don't think that that's necessary just yet. We still are in the midst of encouraging more people to complete their booster vaccinations as they become eligible. And it will take a little bit more time before we come to a need to review that decision, whether to offer our public another booster. At this time, we are also monitoring whether or not there will be an emergence of a new variant, and there's always a possibility that there may be new variants in the future. These variants, based on their inherent characteristics, may require us to augment and enhance the protection that we currently have from vaccines and booster vaccination jabs. But it's premature to posit that we do need these boosters, and when we require them. We will continue to monitor the situation closely and advise accordingly.
Just a quick point that Timothy said, there's a lot of easing in today's announcement. We are not easing. We are streamlining, rationalizing, and resetting our SMMs. In the process, yes, some of the detailed restrictions are being done away with. So if you will, you can consider that. I mean, I suppose the people would think that's easing, but these are details that, as we say, based on our assessment, in fact, are not really that effective any longer anyway. And hence, we are focusing on what's important and what's effective, and we are distilling them to these key parameters.
Yeah, I think maybe Timothy meant easing of confusion, because we are simplifying the rules. But just to add to what DMS has said, and at the risk of some simplification, I think the debate on whether there are more boosters needed, largely it is a debate among scientists now. But I think listening to them, there are roughly two schools of thought. One is protection through ancestral immunization. That means you get a vaccine that is designed for alpha variant or even the original variant, original wild type, and that will protect you not against infection of future variants, but it can protect you very well against severe illnesses. And then there's another school of thought which is going towards the descendants of the COVID-19. That means as you get more and more variants of concern, do you develop then variant-specific boosters to protect against infection? So these two schools of thoughts, I think it's premature to determine which one will prevail, but I think a lot depends on the nature of future variants. If it continues to be like Omicron, moving towards a situation where it's more transmissible but less severe, I think then the ancestral school of thought may have a bit more advantage. But if you go towards the direction of Delta, meaning that you get a new variant that is actually more virulent, more destructive, then you may have to look at variant-specific vaccination to protect against infection. So these are still questions that yet to have answers. So as of now, we do not have active plans to administer a second booster.
Can I just add another point that I think underlying Timothy's question is whether we need to adjust our measures or tightening measures in time to come. We will always have to remember that there's always the risk of a new variant that we do not know today, and when it will come and in what form it will be is something that we will always have to bear in mind. And the effort to simplify the safe management measures today actually will prepare us to be able to respond much more effectively and much more quickly. Let's say, for example, if there's a new variant that is unknown, we may decide first let's manage the borders to prevent more variants from coming in, more cases of new variant from coming in, or we may decide to reduce the group size if we think that the new variant is likely to transmit very quickly, or we may decide to increase the requirement to work from home. So these parameters will allow us to make adjustments very quickly and very clearly, rather than to have to deal with micromanaging each different settings, which will make any adjustment very complicated and very difficult to implement and comply. So I think this adjustment today will allow us to have a more responsive system should a new variant occur. So we always have to bear in mind that there's always the risk of a new variant emerging in time to come.
Thank you, Ministers. May we have the second question from Simin from Zaobao?
Hi, I have a question on the land VTL with Malaysia. So when can we expect private vehicles to be allowed, and is there any timeline on when the Tuas second link will open up? Thank you.
Thank you. We are now in a discussion with our Malaysian counterparts on expanding our VTL land arrangement, including private vehicles as well as private coaches, because today it's only we only allow public buses to travel between the two countries. So I think it's something that we are discussing, and when we are ready, we will make the necessary, the appropriate announcement.
May we have the third question from Melissa from CNA?
Hi, my question is regarding the booster requirement to maintain your vaccination status. So I'm wondering, will this apply to travelers coming into Singapore, say on the VTL, and for them, and when they're in Singapore for the vaccination differentiated safe management measures?
I thank you for the question. As I mentioned earlier, at some point we have to pivot to a new posture where it's not VTL based, but vaccinated traveler based. Yeah, which explains why Minister Iswaran announced his plans to actually proliferate the VTLs, because that is to prepare for the eventuality that we move to a vaccinated traveler system. As to what defines a vaccinated traveler, this is something we are studying, and when we are ready to pivot, we will explain the definition.
May we have the next question from Sing Hui from SCMP?
Hi, good afternoon, Ministers and DMS. So I'm looking at the VTL that we've announced is setting up with Hong Kong. Can we understand why this is happening, especially since it's a unilateral arrangement and travelers from Hong Kong can already come in without quarantine?
Thank you for the question. What we have today, before this reclassification, was basically a unilateral opening. So that was also unilateral, by the way, where essentially we allowed travelers from Hong Kong to come in, and then there were some basic protocols, and then they were free to move around. But with this reclassification now, what it means is that it has to be a vaccinated travel lane, and therefore the traveler from Hong Kong must meet, amongst other things, the vaccination requirement. And in addition to that, of course, the kinds of pre-departure and on-arrival testing requirements that are associated with our vaccinated travel lane. I think that means that essentially those who are not vaccinated or not fully vaccinated in accordance with our rules or requirements based on public health assessments will not be able to participate in this scheme. Why have we done this? Because the connectivity between Hong Kong and Singapore is a very important one for business reasons, but also for people-to-people connectivity reasons. And therefore, we had the unilateral opening prior to this, even though Singaporeans or those coming from Singapore, going from Singapore to Hong Kong, had to undergo quarantines in Hong Kong. And now we have decided that as part of our desire to maintain their connectivity, despite the reclassification, to have this unilateral VTL.
Maybe just at one point in case, just to answer Sing Hui. The reason for the unilateral VTL with Hong Kong is because MOH has reclassified Hong Kong away from Category 1 into this new general travel category, and where there's no more unilateral opening for Hong Kong, which means Hong Kong travelers coming to Singapore now have to serve home SHN. But with a unilateral VTL, they continue to be able to have SHN-free travel so long as they are fully vaccinated.
May we have the fifth question from Hui Min from CNA Digital?
thanks for taking my question. So, with regards to leisure travel, right, one of the key concerns for I think most travelers is the fear of catching COVID while they're overseas and then getting stuck in the country after, for example, they take a pre-departure test and then just before they come home and then they can't get on the flight. So my question is there scope to loosen some of these rules around that so that, as a way to further encourage people to travel or use the VTLs? Thank you.
Thank you for that question. I think the concern is a legitimate one, and in some ways I think it's quite appropriate because we have to take dressing from the protocols that we have established for travel, and those protocols are based on public health risk assessments. So we do have a pre-departure testing requirement. It is now more flexible with ART. We have the vaccination requirement. We have the on-arrival testing requirement, which, as we have just announced, has also been eased with this ability to go now to do your ARTs within 24 hours at our quick test centers and all, for example. So I think it is an important and prudential measure that we have kept in place, and that is also why we have repeatedly advised Singaporeans and others from Singapore who are traveling overseas to exercise due care, to assess the circumstances in the countries they are visiting, to also make plans for contingencies, whether it is taking insurance, etc., should the travel plans be disrupted because of the kind of scenarios you've highlighted. I think we will continue to evaluate this, and we will be guided by the public health risk assessment, and we will then make further modifications. But that is the posture today, and it is designed with public health considerations in mind.
May we have the next question from Si Xuan from Channel 8?
Hello, good afternoon, Ministers and DMS. Can we request a Chinese soundbite for the streamlining of SMM and also the expansion of VTLs? And my question is on the post-arrival test for the travel.
You are muted.
Sorry, Si Xuan, we'll keep to one question.
Oh, I see. Okay, so Chinese soundbite on the new SMMs and travel. OK， 大家可能记得去年10月的时候，德尔他一波的时候，我们那时候的医疗方案相当的复杂。还记得那时候，如果你被感染的话，有一点不知所措，因为条例太多，所以那时候我们就大刀阔斧、快刀斩乱麻的方法，把所有的程序，通通检讨过，就变成了3个程序，就是我们现在的医疗方案1、2、3 Protocol 1、2、3。我们现在是用一个同样的一个方式，就是检讨我们所有的安全管理措施。所以现在我们有一套新的措施，就是安全措施1至5。所以跟医疗方案1、2、3、安全措施1至5两个一起配合，来控制跟管理我们现在的疫情。这个安全措施1至5只有5个措施嘛。第一就是社交聚集的人数维持在5个。第二就是口罩的条例，就是还是要继续的戴口罩。第三就是工作，居家工作，在家办公，现在继续的是50%。第四就是安全距离，现在改变了，就是说，如果你戴口罩的时候，不需要维持这个1米的安全距离，没有戴口罩才维持1米的安全距离。第5就是比较大型的活动、大型的场面，1000人以上要有这个密度的限制。 所以就这样五个方案，5个措施。它的意义是，其实虽然它不代表一个放松的这个情况，但是意义也相当深厚。我觉得有3个意义了。第一个就是这5个措施，其实是我们2年来控制疫情所得到的一些心得，觉得在控制疫情下，在社会安全措施管理下，在对抗病毒啊，这5招最有用啊，其他都是小动作，但是学会这5招是最有用的。所以这5个措施就变成好像有一点5个控制的扭转。如果事情恶化的话，我们可以调上；如果欧米克戎一波已经到了顶峰，然后逐渐的下来，我们可以转下，给它放松。这样一来，我们怎么样的去应付情况，就变得更加灵活，更加能够做得更加敏捷。第2个意义呢，就是对一些小事、小动作就不需要太过操心。好像我们现在说，如果戴好口罩，就不需要保持这1米的距离嘛，所以就很多琐碎的这个条例，我们就不需要去操心了，因为这些小小的条例，真的对我们这个大情况没有什么影响。就好像会议做的时候不需要1米了，不过我们现在没戴口罩，我们需要1米。如果说我们戴口罩，就不需要1米嘛。到公园坐下来，有大家戴口罩也不需要1米，拍个相大家戴口罩不需要拿1米的也不需要保持1米的距离。在联络所，好像有些联络所现在连报纸都没有得看，因为怕传染疾病，所以这些也是不需要的。5个措施以外的东西就不需要多做了，所以会比较放松。我觉得新加坡人都知道，我们现在还在处于危机的情况下，也不需要常常有这些小小的条例一直提醒大家，我们在生活在危机里面。第3个意义呢，就是现在是有一点算作从正面清单变成负面清单的一个意义了。就是说，如果你能够遵守这5个措施，你的活动是可以继续保持下去，继续的做下去。就好像我们现在的烤肉会 barbecue pit， 在公园里的 barbecue pit， 现在都关了，其实是可以开的，只要5个人可以聚集，其实为何不可以开呢？好像比较大型的，好像结婚晚宴也不需要分成不一样的区，现在是一个区50个人，这些也都不需要了。所以检讨的这个措施1至5，相信大家会比较明白怎么样的去抵抗这个疫情。大家能够明白，大家也能够自己尽一份责任，尽一份力，帮忙我们度过这个奥密克戎的一波。我们相信，如果新加坡跟其他国家一样，接下来的几个星期，奥密克戎一波会达到顶峰，然后逐渐的下降。到时候下降，通过这个5个安全措施，我们可以就把它的控制扭转下来，更加的能够开放我们的社会，让大家过更加正常的生活。
We will now take the last 2 questions. May we have the next question from Susanna from Xinmin?
Hi everyone, my name is Susanna from Xinmin Daily News. My question has to do with children who are continually getting infected by the Omicron virus. We have to ask, I ask on behalf of very concerned parents who are continuously very anxious due to the rising numbers. And today there are some reports that there are many school children and also schools with parents getting notified that there are children being infected. So we'd like to ask anyone from the panel, what kind of message can we send to these very anxious parents looking at the infected numbers? And also, how will today's regulation, the 5 parameters that have been revised and streamlined, how will they actually apply to this sector of educators and also parents, how they mitigate, how it implies to them and ease their very anxious concerns over these rising numbers. Thank you.
I'll start off by, perhaps by sharing a little bit about what the situation is with children getting infected with COVID-19. We have seen an increase in the numbers of children getting infected. If I look at it compared to December 2021, when there were about 1,100 COVID-19 cases aged less than 12 years, we saw about 7,200 cases in January. And in the first 2 weeks of February, we've seen over 13,000 cases of children less than 12 years getting infected with COVID-19. This is certainly a doubling, and a very significant rise has occurred. And it's driven by the increased transmissibility of Omicron infections. This trend is likely to continue as our community incidence rises. That said, the majority of these children have mild infection. Even though there's a significant infection rate among these children getting infected, the majority of these kids, in fact, have it very mild. They're either asymptomatic or minimally symptomatic, and the majority of these children do not require admission into the hospitals or into our community treatment facilities. They can safely recover at home. So it is true that children are getting infected. They have a less severe set of infections at this point in time. This pattern of infections can be mitigated with vaccinations. And as a result, I would strongly encourage all parents to consider having their children, if they are eligible, get vaccinated. That vaccinated will protect them from even further from having a severe outcome. And it would reduce the likelihood of transmissions that take place both in the household setting and as well as in the community setting. While we are refreshing, rationalizing, and realigning the measures we adopt to manage COVID-19 in the community, it doesn't take away the need for us to continue to be disciplined, both at home as well as in the schools and in the community. So if we have children who are not well, please don't let them continue to leave the home, to go to school, to go out in the community, to mix around with other children as well. They should safely isolate until they fully recover from whatever infections they have, irrespective of whether or not they test positive for COVID-19. It is important to continue to teach our children the importance of hand hygiene and mask wearing, and to respect the rules of our safe management where it applies to them. These are simple measures in the community that can be undertaken that reinforce the benefit for vaccinations and help to bring a community spread among children under control.
Thank you. I just want to add one point, which is on the issue of education. Since the start of COVID-19, and we had 3 education ministers since COVID-19, the central dilemma is always this, that to prevent children from getting infected, many countries resort to closing schools, or even if they open schools, drastically curtailing curriculum and activities. And you can protect the children that way from infection, but I think the children end up also suffering in many other ways, because they are in their growing up years. To be deprived of education, a holistic development of their person as we know it, has actually also long-term impact on the children. So that has always been a dilemma. So what happened is our schools have a set of actually very robust measures to keep schools as safe as possible. And I think up till now, schools have been relatively actually safe compared to children moving around in the community, or other activities that they participate in outside of schools. But at the same time, we can always manage the risk of children getting infected through all the measures that Kenneth has talked about: hand hygiene, mask on while in school, activities, there are some restrictions, and most importantly now, vaccination. I forgot just now, if I may, I forgot just now to give a soundbite on travel. I should. 我们一向来的这个边界的这些措施呢，主要的目的就是不要引进新的病例。2年来都是这样，所以很多国家都有同样的做法，就是你还没有起飞之前先检测，到达了再检测，然后还有一段隔离的时间，目的就是不要引进新的病例。现在情况不一样了，大家已经接种疫苗，奥密克戎比德尔塔没有那么严重，得到冠病的人现在得到严重疾病的，其实变成一个非常少的部分，非常少的比例。所以而且更重要的就是，现在引进的病例比起内部的病例，其实是一个非常少的百分比。所以呢，现在关注的不是能不能新的病例会不会进来，而是旅客进来过后，他们打了疫苗没有？因为如果还没打疫苗，如果患上冠病的话，可能会得到严重疾病，可能会为我们的医疗体制增加负担。所以这样一来，这个核心考量开始改变了。所以我们一向来的做法就是要有这个安全走廊嘛，就是找一些比较安全的国家、病例比较少的国家或者区域，跟他们实行这个安全走廊。现在做法要改变了，现在讲的不是安全走廊，而是安全旅客。这个旅客打完疫苗没有？已经打2支，加上booster 就是追加剂了没有？这是更重要的一个考量。所以我们逐渐的应该转为一个新的思维，就是转成这个安全旅客的一个新常态。我们不要一步登天，分着几步来走。所以易华仁部长刚才就宣布了，新加坡要开始恢复我们奥密克戎之前的旅游人数，也逐渐的增加更多的旅游走廊，为各个区域增加旅游走廊，以备到一天时机成熟的时候，我们可以转向一个安全旅客的一个新常态，新政策。
We'll now take the last 2 questions. Can we have the next question from Mayuko from Nikkei?
Yes, hi, thank you very much. Can I ask about the traveler-based VTL, or I don't know, VTL
vaccinated traveler.
Vaccinated traveler, thank you. So you are looking at doing shifting to that phase after Omicron is over. May I have the idea? Have you said in a few weeks' time you will possibly be seeing the peak over? So is that the time that most of the general countries will be open for traveling to Singapore? And will that include Japan when Japan is still closing the border?
Thank you. Let me just repeat my soundbite in maybe the right order so that it's clearer. Basically, if Singapore is like other countries, we should expect in the next few weeks Omicron wave to peak and then start coming down. And when that happens, and we hope it happens soon, sooner rather than later, we can then take a more decisive step to ease up both social restrictions as well as travel restrictions. What are we moving towards is a vaccinated traveler scheme. But we don't want to move it now or in one abrupt step. We will take it in 2 steps or a few steps, starting with what Minister Iswaran mentioned, proliferating more of our VTLs, restoring some of the VTLs, or rather restoring the implementation of the VTLs that we have deferred. Yeah. And when the time comes for us to move to a vaccinated traveler scheme, certainly vaccinated travelers from Japan will be very much welcome and included in the scheme.
We'll now take the final question from Jane from Mothership.
Hi, thank you so much for taking my question. So could you elaborate more on the logistics behind the shift from a health risk warning to health risk notice? And does this mean that it's being changed from an order to an advisory? And why was this change made? Thank you.
Thank you very much for the question. I had explained before that the science informed our policy, that we had recognized that with the Omicron variant, people were, if they were exposed and getting infected, the incubation period was much shorter than it was before. And when we were doing whole genome sequencing, looking at the variants that were causing infection in Singapore, practically all infections in Singapore now are Omicron infections. So with Omicron being having shorter incubation periods, it applies to all practically all people getting infected with COVID infections now in Singapore. So with that shorter incubation period, it provides us with an opportunity also to review our protocols, particularly Protocol 3, and to then shorten the period of isolation that is needed. Instead of now 7 days, we allow it to now come down to 5 days, and we think that would be a reasonable period at this point in time. And once you've completed that period, you remain well, you test negative, we're confident that you can actually return back into your normal activities, into the community. You are past that high-risk period for you to manifest symptoms and get infected and become infectious as well after that initial exposure, being a close contact for someone else. The traditional health risk warning was intended really for managing a longer incubation period. And if we are shortening the incubation period, the traditional health risk warning becomes less relevant and less fit for purpose. And this is the reason why we had to move away from using a health risk warning, and we move now to what we describe as a health risk notice, or HRN. The HRN is an advisory that gives the person that advance notice, knowing that he now has been subject to that contact with a person who is infected, and allows him now to exercise that self-vigilance and take the precautions to isolate himself and to monitor his own health. It is not the same as health risk warning. It's not backed by a legislative requirement, and it doesn't require a mandated period of self-isolation. But this is in keeping with our general approach to emphasize a lot more self-responsibility in managing one's health, as well as managing COVID-19 infections. And it is in keeping, therefore, in that spirit that we continue then to design the health risk notice as an advisory rather than as a mandated requirement.
So maybe if I just emphasize something that DMS said, which is HRW is a legal obligation. HRN is not. And so what it really means is that we need to exercise a lot more self-responsibility, in the sense that if you are infected, you should tell everyone that you have come into contact with, your colleagues, your family, friends that you have just met. And they should then exercise that self-responsibility to test themselves when they go out. Yeah, just as even though they have not received a formal HRW now, they should start to do that. Yeah, and so it requires a lot more self-responsibility. A few days, a couple of days later, you may well receive a HRN, but it's more important that at the immediate point, at the point that you are infected, inform your closest contacts so that they can start taking responsibility. So that's essentially the core of what has changed for Protocol 3.